I'm Emily Allen with AARP Foundation. After a prolonged pandemic that made it difficult for so many of us to connect with loved ones and our communities, the world woke up to the negative effect of social isolation on health and well-being, especially for vulnerable older adults. But often overlooked is the impact it has had on the financial health of individuals. Many older adults lost their jobs during the pandemic and now struggle to re-enter the workforce. Due to health concerns or other circumstances outside of their control, many others are unable to work and find it more and more difficult to make ends meet as the cost of food and other essentials increase. Whether it's through initiatives to bridge the digital divide, such as AARP Foundation's Digital Skills Ready at 50+, or helping older job seekers connect to a network of mentors and peers through AARP Foundation's Back to Work at 50+ program, we are committed to helping older adults build the social connections and networks they need to build economic opportunity in 2023 and beyond.
Hi, my name is Joy Chen, and I am the Director of Strategy and Operations at ACTNow for Mental Health, also known as ANMH. We are a nonprofit dedicated to destigmatizing mental health and increasing access to mental health services for young adults between the ages of 17 to 32, particularly for populations that have been historically underserved by the medical system. This demographic is often overlooked, but experience some of the highest rates of mental illnesses and are often uninsured. We at ANMH are here to help by providing free telehealth therapy services and topic-based support groups to all young adults in the DC, Maryland, and Virginia area. In 2023, we are committing to expanding our reach by growing our provider network and adding 15 providers by the end of 2023, and hopefully doubling our client list from 75 to 150. We also are always looking for volunteers, so if you are interested or want more information about our organization, please check out our website at anmh.info.
Hi, this is Steve Downs. I'm the co-founder of Building H, which is a project to build health into everyday life. Our focus is on how do you create the environments that make it easier for people to engage in healthier behaviors. Our core effort is the Building H Index, which looks at the impact that popular products and services have on the health of their customers. We look at 4 industries: entertainment, food, housing, and transportation. Companies like Netflix and Uber, like DoorDash and Instacart. We look at the influence that they have on how their customers eat and sleep, how much physical activity they get, how much time they spend outdoors, and of course, relevant to this conference, their social engagement. Earlier this year, we released a report that assessed the impacts for 37 companies, and over the next year, we intend to expand and update that index, doubling the number of companies and refining our measures. We will continue to focus on social engagement as one of the core behaviors that we assess, and we'll make sure that we're using the latest research on social connection and health as we refine our measures.
Hi, my name is Catalina Langen. I'm co-founder at Civic Wellbeing Partners based in Santa Monica, California. We are committed to action on social connection through our local, national, and international work. Locally, our Wellbeing Microgrants program supports short-term action for community well-being. Here are some of our microgrant leaders sharing their own statements of commitment.
Hi, my name is Donnie Lunn, and my wellbeing project is Deep Listening. I work to increase social connection by expanding awareness, calming the nervous system, and cultivating the spirit of collaboration. Thank you, Pauline Oliveris, for developing this practice.
Hi, my name is Kalina Silverman, and my well-being project is Big Talk for the Community. I work to increase social connection by inspiring and moving people to skip the small talk to make more meaningful connections in life. Thank you.
My name is Eileen Escarce, and my project is A Good Beginning for Child Wellbeing. My goal to increase social connection and reduce isolation by bringing together expectant parents before their babies are born in order to teach them evidence-based practices to learn how to read their baby's cues.
Hi, my name is Michael Goldstrom, and my well-being project is my startup, Get Motivated Buddies, which improves social connection through shared behaviors. We use positive reinforcement, group challenges, and meaningful relationships. Thank you.
Hi, my name is Lizette Antonio, and my well-being project is Make Your Own Cloth Face Mask for COVID-19. Through my project, I work to increase social connection by providing learning opportunities, affordable and sustainable ways of accessing masks, and finally providing language accessibility in English and Spanish. Thank you.
Hi, my name is Rebecca Canara with the Universal Human Rights Initiative. Our Wellbeing Project brought solar-powered chargers to unhoused neighbors in Santa Monica in order to both build bridges between housed and unhoused folks and also support people when the libraries were closed and other charging capabilities disappeared.
These wonderful leaders and dozens like them are all doing their part to address loneliness in Santa Monica in partnership with Civic Wellbeing Partners.
Hello. Thank you for the opportunity to commit to take action to end social isolation and loneliness. My name is Mark Merity, and I'm the Executive Director of DOROT, a nonprofit social services organization located in New York City. DOROT's commitment to alleviate social isolation and loneliness is not new. For over 45 years, we have developed innovative programming to help older adults stay connected to their community. DOROT engages thousands of older adults and volunteers from around the country who participate in programs that are held virtually, over the telephone, and yes, thankfully, in person once again. These programs give participants the opportunity to develop meaningful connections and friendships. One of DOROT's key strategies to help older adults stay connected is to bring the generations together. Our intergenerational programs provide older adults and volunteers of all ages a unique opportunity to share life stories and to create meaningful bonds. These programs enrich the lives of everyone involved, no matter what their age. Since the pandemic, there's even greater appreciation for our work and has taken on even greater importance than ever before. We are committed to leverage this increased interest and exponentially grow our programs and our impact. By bringing the generations together, we are giving individuals the chance to interact with others who may be very different from themselves. When the young and old unite, ageism and other stereotypes can melt away. Breaking down social barriers helps build a better understanding and greater empathy towards one another. That is why our work is so very important, and that is why we are committed to taking additional action. DOROT pledges to, number one, increase public awareness of the devastating health consequences of social isolation and loneliness. Number two, build partnerships with like-minded organizations. 3, leverage innovative intergenerational solutions to foster connections for individual and societal benefit. And 4, share our programming with organizations throughout the country. We are excited to partner with the Coalition to End Social Isolation and Loneliness around our shared mission and participate in this year's Action Forum. Thank you very much.
Hey everyone, I'm Katie Holcomb from Humana's Health Equity and Community Engagement team. Like everyone else, Humana had a busy year in 2022, making lots of progress on our efforts to drive the transformation of healthcare to become more holistic, high quality, integrated, affordable, and equity-centered. You may recall our ongoing commitment to action for the Coalition, our Far From Alone initiative, a public health awareness campaign that brings together partners committed to addressing loneliness and social isolation and promotes resources to help people feel more socially connected. In the last year alone, we have had 15 organizations join our Far From Alone campaign, adding more resources to our website to help people with loneliness and bringing our total to over 40 organizations to date who have joined our campaign. This has diversified our audience to include veterans, military, children and parents, and people looking to reduce loneliness within the workplace. But our biggest focus and our commitment to action last year was to increase our efforts in directly reaching individuals experiencing loneliness by activating Far From Alone at a community level. You can have a great website with tons of resources on it, but how do you take action to meet people where they are? So here are a few highlights on what we've done this year. We teamed up with the Foundation for Social Connection to recognize Global Loneliness Awareness Week in June, with special events in 5 different cities and Humana markets, including a screening of the documentary All the Lonely People, written and directed by Stu Maddox and produced by Joe Applebaum, and a national event in DC that included Surgeon General Vivek Murthy. We also began promoting Far From Alone in Humana's neighborhood centers to raise awareness on loneliness and share resources with people in communities around the country. We also began training Humana clinicians on Far From Alone, including social workers who serve our members in need. Last but not least, we partnered with Generations United this past September to recognize Grandparents' Day and promote Far From Alone through special events in several markets, encouraging intergenerational connections as a way to address loneliness in this critical time for grandparents and grandfamilies as they face barriers to self-care and mental health throughout the pandemic. So what's our next commitment to action? Now that we've activated Far From Alone within local communities, the next phase of our strategy expands our outreach to empower more clinicians in healthcare settings, such as physicians and nurses who serve individuals affected by social isolation and loneliness. Some of the key activities we have planned include training and support to more doctors, nurses, clinicians, caregivers, and social support teams on our Humana Community Navigator, a community resource tool powered by Find Help that connects people to direct services that address social health needs such as access to food, transportation, quality housing, and of course loneliness through community support groups that promote social connectedness. Our goal is to ensure that clinicians know how to find the right resource at the point in time they are serving patients, enabling them to more effectively and widely screen their patients for health-related social needs and refer them to tools like Far From Alone. Humana is so proud to be part of the coalition in this year's Action Forum. We are all truly making a difference together and bringing a much-needed spotlight on loneliness and social isolation. We encourage you to visit farfromalone.com and join us in this campaign, or simply share the website with your loved ones to help anyone experiencing loneliness. Thank you.
Hello everyone, my name is Maureen Feldman. I'm the director of the Social Isolation Impact Project for the Motion Picture and Television Fund, also known as MPTF. I'm honored to be invited back to share bold goals for 2023 for both MPTF and our LA-based coalition. MPTF is committed to addressing social isolation and loneliness on a broader scale. And in 2017, we founded the Los Angeles Social Isolation Impact Coalition, which now includes over 62 nonprofit organizations, academic institutions, and government agencies, all committed to reduce social isolation and loneliness and advance social inclusion. Our collective efforts have not gone unnoticed. In December 2021, the Los Angeles Board of Supervisors unanimously voted to make social inclusion a priority. A comprehensive countywide plan has already been created, which includes public awareness campaigns, collaboration with external partners such as school districts, cities, communities, faith and community-based organizations, and philanthropy. Dr. Laura Trejo, LA County's new executive director for the Department of Aging and Disability Services and a passionate supporter and member of the coalition, has developed a strategic plan to make social inclusion a priority across the lifespan in several LA County departments. She invited the Departments of Social Services, Health and Welfare, Aging and Disability, Child Services, Mental Health, and even Parks and Recreation to implement this initiative as a preventative tool with social inclusion at its core. They all agreed. The Los Angeles Social Isolation Impact Coalition is committed to and will work to implement various aspects of this strategic plan and will assist in scaling these new initiatives. LA County is also rolling out several technology initiatives to provide older adults not only access but training and mentorship opportunities. I'm hoping to report more on that next year. MPTF will continue to grow our existing programs by expanding those that we have for individuals with memory impairment and their often overlooked family caregivers. MPTF will co-host or co-sponsor our 5th Summit on Social Isolation and Loneliness in 2023, and will increase the number of agencies and organizations that are serving populations of all ages to attend, as we know that social isolation and loneliness does not discriminate by age. I'm very proud of the work of LA County, the progress of the Social Isolation Impact Coalition, and MPTF for recognizing the need and taking collective actions. Thank you to Cecil for broadening this conversation and for highlighting the research and supporting all of us in our mission to reduce the harms of social isolation and loneliness.
Hello, I'm Florence Mauchamp, and I founded NeverTechLate in 2019. Thank you, Cecil, for all your support and allowing us to share our 2023 goals. NeverTechLate mission is to bridge the gap between the digital world and older generations. As research shows, an increase in loneliness and social isolation means an increase in instances of neurological and cardiac illness. Lifelong learning and engagement promotes independence and healthy aging in place. And the ever-growing digital gap creates more inequalities across the age spectrum. NeverTechLate provides a rigorously researched online curriculum on how to use a tablet, how to communicate remotely with family and friends via Zoom, and how to stay safe online. NeverTechLate is honored to join Cecil and others to be part of this important network of fellow organizations that fight every day to end social isolation and loneliness. We are pleased to submit an ambitious commitment to action for the upcoming year 2023. 1, we pledge to teach 100 students and hope to surpass it. 2, we plan to scale through 2 market entries, low-income communities and libraries, and to conclude discussions with the university to include NeverTechLate offerings on their campuses. We are completed our second module, emails and general troubleshooting, and we are adding 2 additional modules, telehealth and Uber and Lyft. 4, we will certify additional coaches, extend our train the trainer program. 5, we will finalize funding strategies. NeverTechLate intends to meet these goals by continuing outreach efforts toward older adults organizations, by continuing to conduct high-level conversation with key stakeholders such as corporate or government agencies. And again, NeverTechLate is honored to be part of the Cecil and Foundation for Social Connection networks, a critical source of support when working to meet the pledges which I shared with you. Thank you for your attention, and we look forward to meeting you soon, either in person or virtually.
Good afternoon. My name is Carol Fisher, and I have the privilege of serving as president of NPHI. NPHI is the National Partnership for Healthcare and Hospice Innovation. We are a member organization, a collaborative of 93 not-for-profit, community-integrated hospice and palliative care providers, all dedicated to ensuring that patients and their families have access to care that reflects their individual goals, their personal values, and certainly their individualized preferences. Representing providers from 35 states and the District of Columbia, NPHI and its members help design more innovative, more effective models of care. We always strive to build collaborations between national thought leaders, decision makers, and other healthcare stakeholders, all aimed to improve hospice and advanced illness care. Collectively, our members care for over 85,000 hospice patients, including palliative patients, each and every day, 85,000 patients. And last year, over 26,000 volunteers provided care. They provided care at the bedside, they were in grief support rooms, and in other numerous ways. But all these volunteers were committed to our work and to our mission. NPHI members also provide really robust grief support programs to families of patients and also to anyone in the community at large. Our members are always welcoming anyone who has suffered the loss of a special person. You know, we really understand that we meet both socially isolated and lonely adults, many older adults each and every day through our work. And we know that social isolation and loneliness increases health risks, and it's magnified in the lives of those suffering from an advanced illness at the end of life. We also know there are studies that also tell us that the loss of a spouse and a loved one really increases the risk of feeling isolated and lonely. And while, we certainly, know that we accompany people who are seriously ill at the end of life, and we're committed to that, and we're committed to those grieving, and we do that really well. We also know that we could do better and we could do more. So in this coming year, all of us at NPHI are really committed to looking more intentionally at how we can be more effective in measuring and addressing both social isolation and loneliness among our patients, the families that we serve, our staff that work for us, and the grieving clients that we support every day. And we're going to do this work through our innovation lab. The innovation lab is well-positioned and poised to aggregate and to test and disseminate best practices that reduce feelings, all designed to reduce feelings of isolation and loneliness. And this means that we're going to take responsibility to have a deeper conversation. We have all of our members collectively employ over 28,000 staff, and we're going to have a deeper conversation with these staff that we are so privileged to work with. And we're also going to take a deeper cut at having really thoughtful conversations with our community partners as well. You know, we get this work, we understand the work, it's important work, and we're just so grateful to be part of the coalition to end social isolation and loneliness. And I must say, on behalf of all of us at NPHI, we applaud the work you're doing, and we look forward to our future collaborations.
Hi, I'm Elizabeth Cutler. I'm delighted to be here with you today. I'm here because I'm the co-founder of SoulCycle with Julie Rice, and we have started a new company called Peoplehood, which is basically a place for facilitated conversations, a place to come together, a place to experience a dose of humanity. And this happens through 60-minute facilitated conversations. What we found in the last 3 years is that connection's just so sorely missing in our culture. We've stripped so much of it out, and we want to put it back in. We need spaces and places and scaffolding and structure to be able to connect with ourselves and each other in a way that makes us feel more human and more alive. And so I wanted to invite you to come experience Peoplehood. We've seen all the data that you've seen. It's been heartbreaking for us. And so we felt like if we could just create an environment where people could come together and see themselves in one another and listen to themselves think, that could be a good thing. So basically the structure of a gather is that, as I said, it's 60 minutes. There's between 12 and 18 people in a group. It's led by a guide who is facilitating the conversation, where we listen to what's going on for each other in a way that is just human. And then we break out and practice the act of listening with another person. And what we find in that is that by hearing ourselves think, we get the answers that we need. And let's face it, we're going to solve our own problems together. So we'd love to invite you to come and experience Peoplehood. You can check out peoplehood.com, or you can come or you can email us at people@peoplehood.com. We really appreciate the opportunity to be able to be a part of this conversation. We're really excited about the work that you all are doing to end social isolation and to deal with the issues around loneliness. And the best way, we think, for us to do this is together. So thank you again for having me. And we look forward to seeing you in a gather.
My name is Andy McMahon, and I serve as Vice President of Community Investment and Innovation at UnitedHealthcare Community and State, which is our Medicaid organization providing healthcare to more than 7.5 million members in 31 states plus the District of Columbia. At UnitedHealthcare Community and State, we focus on an integrated approach to care management based on a comprehensive approach to member needs, including social support needs. With the pandemic highlighting the impact of social isolation and loneliness on overall health, we have focused now on identifying our members who are experiencing social isolation and loneliness and who are experiencing it acutely, and then finding and implementing effective solutions and interventions to support our members. Our commitment for 2023 is to develop and implement an organization-wide strategy for our health plans to effectively recognize and combat social isolation and loneliness among our members. In collaboration with the Foundation for Social Connection, we have developed a guide for state Medicaid plans to drive and support their social connectedness initiatives. Over the next year, UnitedHealthcare and Community and State will enter phase 2, strategic deployment of social connectedness strategies in markets through pilot testing and educational activities. At UnitedHealthcare, we understand the importance of social health and the detrimental effects that disconnection has on overall health, especially for historically underserved populations. We are committed to expanding our knowledge on social isolation and loneliness and our impact on communities to provide individuals and families with the best health outcomes possible. Thank you for the impactful work that you are all doing and your dedication to advancing health and healthcare for all. Thank you.
Hello, my name is Annette Fellows, Vice President of Health Products and Services at UnitedHealthcare, and I lead our healthcare transformation team. UnitedHealthcare serves 1 in 5 Medicare beneficiaries, and in partnership with AARP Services Incorporated, we explore and implement innovative methods for caring for our Medicare supplement beneficiaries. With the goal of helping our beneficiaries lead their healthiest lives possible, at UnitedHealthcare, we understand that personal circumstances and experiences outside of the medical office heavily impact health. Personal experiences such as the size of one's social network. So at UHC, we are focused on personal drivers of health, or PDOH, as an additional lever of care focused on developing and leveraging an individual's resilience through factors such as purpose, optimism, and social connection. In 2023, we are committed to further expanding our work on personal drivers of health within UnitedHealthcare. We are continuing to do research and implement interventions. We are continuing to measure outcomes related to health and experiences and evolving our work based on those outcomes. At UnitedHealthcare, we understand that the importance of caring for the whole individual, medically, socially, and personally, as it relates to their emotional health and well-being. We are excited to be continuing to do this work alongside all of you and the Foundation for Social Connection, and just want to say thank you for all of your contributions in this space. I know working together, we will be making a very big impact on how our health is designed and delivered as we move forward. Thank you.
Hello, I'm Sandy Markwood, CEO of US Aging, which represents and supports the network of area agencies on aging and advocates for Title VI Native American aging programs throughout the United States. Combating social isolation and loneliness is a priority of US Aging and our membership. At past action forums, I've mentioned the many steps US Aging is taking to alleviate social isolation and loneliness through 2 key initiatives. The National Resource Center for Engaging Older Adults, also known as Engaged, and Commit to Connect. We are so proud to have served as the administrator for Engaged since 2017, and we took on the role as the administrator of Commit to Connect this past spring. These social engagement efforts are funded through the Administration for Community Living and are led by US Aging in collaboration with partners. A few of our recent accomplishments have included adding more than 30 additional innovative social engagement programs to the Engaged Social Engagement Innovations Hub to help organizations replicate successful social engagement programs in their communities. Developing publications that provide organizations with examples of best practices, strategies, and tips they can use to enhance their social engagement programming. Releasing consumer-friendly social engagement materials that local agencies and organizations can co-brand and share. Increasing the membership of Commit to Connect nationwide network of champions. Disseminating a literature review detailing the most pertinent research on intergenerational social engagement activities, and launching the first community of practice for Commit to Connect with a focus on intergenerational programming to provide an opportunity for professionals to share their knowledge with one another. U.S. Aging is committed to expanding and enhancing these social engagement efforts in this year and beyond. We will continue to work creatively and collaboratively to grow technical assistance and training opportunities, serving more organizations in the aging and disability networks, as well as partner organizations. We'll continue to expand the membership of the nationwide network of champions and build resources to meet champions' needs. And we look forward to continuing to work alongside partners like CECL and the Foundation for Social Connection as we, along with all of you, work to move this important work forward. Together, we can combat social isolation and loneliness and promote social engagement. Thank you.
At Visible Network Labs, we have a vision of a world where everyone has the social support they need. Social isolation, loneliness, and other types of adverse social connectedness have reached epidemic levels, impacting the health, mental health, well-being, and mortality of people worldwide. And while we're all embedded in some kind of personal support network, they are mostly invisible, not only to ourselves, but to the people who are trying to help us. You can't look at a person and know whether they have someone to help them if they need it. Our team is committed to using network science, data, and technology to make these invisible networks visible. Our goal is to bring tools and resources to a person's care by offering assessments and screenings to understand these hard-to-measure concepts about people, so providers and other helping professionals can quickly know if a person is at risk of adverse social connectedness. We built Partner Me with a strengths-based philosophy that honors the assets a person brings to their care while identifying gaps and creating social care plans to connect them to resources they need. On behalf of Visible Network Labs and myself, Danielle Varda, we are honored and proud to join the Foundation for Social Connection and all partners at the End Social Isolation and Loneliness Action Forum. And we're committed to continue this work together to ensure that everyone has the social support they need to thrive.
Hi, I'm Dr. Claude Pinnock, Chief Medical Officer at Wider Circle. We're a community health organization on wheels that comes to people's neighborhoods to support them, provide resources and social support, and help them navigate their health through giving them a community to lean on. This ensures people get the most out of their local resources, benefits, and addresses the social and behavioral determinants of health, giving them the community they deserve to live a healthier and happier life. We work with Medicare and Medicaid populations serving over 320 communities nationwide, and we are honored to give you our commitment to action at the 2022 Action Forum. Wider Circle began focusing on loneliness and isolation as a primary driver of health outcomes and quality of life back in 2015. The overwhelming body of scientific evidence shows that being estranged from your fellow human beings erodes motivation, leads to depression, and undermines the effectiveness of care management efforts. So we developed a care delivery model that leverages data to socially engineer and form lasting groups of like-minded neighbors to tackle this problem. This enables our team of specialists to act as upstreamists, finding hard-to-reach members, building trust with them, and addressing social and behavioral determinants of health, whilst our members themselves create bonds with one another and inform and empower each other to achieve better health through their shared lived experiences. Our commitment to end social isolation and loneliness is grounded in our company vision to make sure everyone has a friend to lean on. Within 5 years, our goal is to become 1 million members strong, and we look to do this by scaling our programs from 14 to all 50 states so that everyone has a chance for happier, healthier, longer lives. In a recent study conducted, members reported an overall 54% improvement in perceived loneliness and positive mental health days compared to controls. This also had downstream effects on other important health outcomes like hospital bed days, emergency department use, and annual wellness visit rates, where we observed a 63% and 13% decrease and 23% increase, respectively. We continue our commitment to fight the loneliness epidemic and help other populations realize similar benefits and live healthier and happier lives. I will conclude with a quote from our friend Maria, a longtime Wider Circle member and a volunteer ambassador who puts it best. We don't give old age a chance because of the joy we share with each other. Thank you.